even my biological dental friends said, when they heard that a 76-year-old could see substantial recession diminution. You know, there's that old expression, I wrote it long in the tooth. Long in the tooth is a silly thing. Your teeth don't elongate, your gums shorten. So long in the tooth is an expression for aging, and aging not that well, by the way. But really, it's you know, there's a number of different markers out there. I saw someone this morning that did a true diagnostic test, and his age is 66, but his true diagnostic age is 60. Gum recession might be another sort of barometer. And it's important to understand who this gentleman is. He's someone I've been working with now for almost a couple of years, maybe 2 years plus, and he has some different things going on that we're working on. And you know, we take 2 steps forward, 1 step backwards. We took a couple of steps backwards and step forward, but overall, I think he's feeling pretty good right now. But the thing about Robert, as a retired gentleman at the age of 76, is he's very methodical about recording information. So lung volume, boy, did he record his lung volume. I mean, we're watching that traipse its way up from a fairly low, below where he should be for his age, to where he should be for his age. Blood pressure, very meticulous about the analytics and recording it. So when Robert tells me something, that something has either got worse or got better, there may be subjectivity to it in terms of how he feels, but he also documents things very objectively. So when he wrote to me about a month ago about this change, I was very excited about it. So he said, "My name is Robert, I'm 76 years old. Please see the accompanying periodontal exam graphs," which I'm not an expert at, but will highlight the key things. So the original and last 2 of the actual exam charts are included for reference and validation. They're in here. I will publish this if he gives me permission to, unless he thinks I botched it. But this is what he wrote to me. My first exam was on May 2011, so 11 years ago. There was advanced periodontal disease. It shows some 5s, some 4s, no 1s. And this, we're talking, I think it's millimeters of recession of the gum. So 5 millimeters is pretty substantial. From advanced periodontal disease to completely normal, my last exam in August of 2022, number 11 on the graph shows 0 4s and 22 1s. It's a dramatic turnaround. Okay, so from advanced periodontal disease to completely normal, although this took 11 years, most of the improvement in the number of number 1s occurred in the time between the last 2 exams, a period of 6 months. So even though he's been fastidious about this and working at it, he's seeing the greatest improvement. So I would suggest from a log linear perspective, some of the things he was doing previously have been helpful, but what he's done most recently has tipped him over the top. And so we'll go over that in a second. And hopefully I can get my printer to stop. So I attribute this, and what he means this is the most recent results in the last 6 months, to the introduction of Dioxy rinse in November of 2021, used once daily in the morning. It can be used twice daily in the morning and at night. And I've had these bottles on my counter, my bathroom counter now for about 5 months. And I will say that my bathroom counter has experienced no change in recession. But myself, we don't know. So this morning, I tried it for the very first time, and we'll go over the protocol. And I got the same effect with this that I got with a pharmaceutical I use now and again to clean my teeth. And it almost feels like you've been to a hygienist. You know, when you've been to the hygienist and they scrape all the tartar away and you rub your tongue on the back of your teeth and you kind of feel the ridges. In one session, I'm beginning to feel like my mouth is already cleaner. Maybe it's the placebo nocebo effect, but Robert's is not. So the charting. So we see original exam, and then this is the amount of recession, 12-1. So we're seeing a good amount of improvement in our numbers. And this is the most profound one, where we have 16 is new. It went from what, Robert? A very large number to 0 in terms of the recession scale in that tooth. And he's had different hygienists, the same hygienist over different times. I don't have the exact timeline on that, but he feels that from an objective perspective, and it's not hard to measure recession. You know, you can tell where the gum should be, and you measure in millimeters. So it's not something that requires fine tooling. So 23 better, 11 or worse, but they're not bad compared to the ones that have improved. Let's see here. More data, which just kind of shows the number of improvements. I really can't read this, and I'm not going to attempt to, but overall, we're seeing improvement. This is the key thing, and I thank Robert for this, because otherwise I have to read these charts. But what he says, 5-11, 9-11, he's seeing a dramatic reduction in the number of 4s. Okay. 5-11, 12 4s, 1-5. Okay. So we're just seeing an overall improvement in that. And so this is the product that he's used, if you're not familiar with that. And we'll go over the protocol in a second, but I give you the link, Frontier Farm. There may be other sources, but this is the source I believe Robert got it from. So frontierfarm.com. And let's see. Oops. I will try to put this in the chat, but right now I'm stuck in a mode where I can't copy it. So what is... Yes, sir. Let's see if I can find and put it into the chat. So there it is. Oops. So there we go. And they have a bunch of things, but I believe he's just using the one product. So let me see if I can find my chat. There we go. Yes, okay, we have it out there, and I'll give you the full link. Good. So next. So Dioxy rinse is basically chlorine dioxide, which was covered in a Zoom meeting. We talked about it with David Harshfield. We talked about it with Dr. Rainier. So we've had a couple, and there's some stuff published out there on that, but we didn't necessarily go into the specificity of how to use it for oral care. And I think, but I don't have proof of this, that at the concentration you're making it in this Dioxy rinse, you don't go all the way to chlorine dioxide, or you get very little chlorine dioxide. I think what you're really getting is chlorous acid. And hypochlorous acid is used to treat the skin to reduce wrinkles. We think it's treating a mite, an under the skin mite, in doing that. Hypochlorous acid is used to nebulize and spray to clean up barriers against infection like SARS-CoV-2. And then your gut has hydrochloric acid, which is a much, much stronger acid. So I think this is what we're really producing here. Which is covered in the Zoom meeting. It's convenient 2-bottle product. One bottle is solution sodium chloride, and the second bottle is citric or lactic acids. So these are actually very weak acids. That's why I don't think we're producing chlorine dioxide that requires a stronger acid. I think we're producing the chlorous acid. So what you do is you take bottle A and B. This is what Robert got. 3 pumps of each into, I just put it in a shot glass, and then I let it sit to activate. It takes a little while for that sodium chloride to be converted to the acidic form. So the active ingredient. So Robert says on their listing is you get 200 ppm of the chlorine dioxide. But, you know, when I make up the chlorine dioxide as a treatment, I feel you can really smell the chlorine type odor, where this you can't whatsoever. You swish this for 30 seconds, then gargle it for another 15 seconds, then you spit it out. The other products are available. Okay, so this is the main thing he's doing once a day in the morning. This is the only substantial change that was in effect during the 6 months between the last 2 exams to my oral hygiene regime. And that's where he saw the most profound improvement in his recession. Having 2 root canals, so other things he's done, very important. Had 2 root canal teeth pulled and replaced with implants. One should opt for implants and not have a root canal done in the first place. Thank you, Robert, I agree. The other was taking half of, should be these, I think, Baja Gold Salt. We had that lecture by our gentleman that is carrying on the torch for Maynard Murray. He began that in December of 2021, brush 3 times a day, but only eat 2 meals a day with intermittent fasting. Use a water pick 3 times a day. And I will tell you that the people who water floss, hydrofloss, water pick multiple times a day, when we do the oral DNA testing, tend to have the lowest burden by far. So I know it's not necessarily that convenient to be doing that 3 times a day, but I think that's even better than brushing 3 times a day. So if you're brushing twice a day, water floss the same number of times. He makes his homemade toothpaste, combination of baking soda, sea salt, and a little xylitol. I've also adopted 2 of my programs, putting the povidone iodine into his water pick. Could be done, yeah, he's just doing it once a week. The iodine is able to penetrate biofilms. If it's brown, it's elemental iodine, diatomic molecule, so it's neutral. It can penetrate into biofilms, and it's a very strong antiseptic. And so he also does, and this came from my mentor, Dr. Tremp, he will have a saturated sea salt solution, and then I assume either dip his toothbrush in it, but you can brush with this as well. I'm brushing with straight up salt. Salt, preserved meat. It's an antibacterial, so it's a good thing. My mentor told me that as an ophthalmologist, he looked at everybody's teeth too, and when people were quite old and had really good gums, he asked them what they did, and very frequently, I'm not sure what percentage of the time, the older folks that were brushing with salt had the best gums. And I think it's never one thing, so we're going at it from multiple perspectives. You know, Tom Levy talks about hydrogen peroxide daily. I don't think that's the best advice. I work with a number of nurses, and the nurses always tell me that when you put peroxide on a wound, one time, okay, but if you keep applying it, it slows healing. We think that peroxide is a little too aggressive against good organisms as well as bad organisms, and you have a microbiome on your skin and your mouth and your gut. So if you insist on peroxide, my recommendation is no more than once a week. Now, Tom Lockensgard told me that the biofilm, when you do a thorough cleaning, doesn't come back for a few days. It starts aggregating into tartar, essentially. It starts off as a slimy film that then aggregates, kind of like the barnacles on the shore. You know, you go down by the shore side, ocean side, like in Booth Bay Harbor, and it's all slippery and slimy. Well, that eventually will form into those solid barnacle structures, okay? So the same thing happens. So it could be that he could have got the same results by doing the Dioxy rinse once or twice a week. rather than daily because of the way the biofilm reforms. Okay, particularly if you go and get a dental hygiene visit, then you probably don't, you get everything cleared out and you probably don't have to do it every day. But we're in unknown territory, and I'm trying to balance between anti-infective and your microbiome, because your best daily antibiotic is your probiotics in your system. So that's important. Other than using the Dioxy rinse once daily, I have no other reason to account for the dramatic improvement in my periodontal health. And, I thank him very much for sharing this information and allowing me to share. I would have had him present, but he's not necessarily there with a computer, even though he's listening today. I'm writing this chapter on oral health, and I've almost finished, and I want to just cover a couple things. And I think even though I always promise to do things and sometimes don't necessarily follow through with it, I'm going to put out excerpts from my oral chapter in pieces, because I'm reading Tom Lockensgaard's book, which isn't published yet, called Matters of the Mouth, and what I'm writing is very different. So it's like we do not have saviors out there for us in the traditional world. So here's my alma mater, MIT, and this is the very beginning of my oral chapter book, oral chapter in the book Health, Freedom, Lost. And I have the McGovern Institute for Brain Research. Spent a lot of time trying to talk to those people. The Pakawa Institute for Learning and Memory. I spent a lot of time talking to those folks. Me and Dr. Tramp, Dr. Burke presented on what we're doing. Some of Judith McClosey's work, which I'll show you in a minute, which I've shown in the past, but don't miss Brian Balin's talk coming up in a month or so, because he is an expert on brain health related to organisms similar to the oral organisms, which is why I'm talking about this. So we told them that we think we have a better, a complementary, not a better approach to what they're trying to develop. And McGovern funded this to the tune of 1.2 billion, and I don't know what the Pakawa budget is. But here's Paul Gray, one of the most beloved chancellors, presidents of MIT's history, and here he is with Alzheimer's. So I read with sadness about 3 years ago that Paul Gray died after a long battle with Alzheimer's disease. Probably had it when Dr. Burke and I were talking to these folks, to crickets, by the way. They have their agenda. My mentor at, not my mentor by a long stretch. My advisor at MIT was the youngest chaired professor in their history. And then he went on to be chancellor at Washington University in St. Louis. And I called him one day after reading something from the medical school at Wash U and what they were doing. And I said, Mark, you guys are heading in the wrong direction. And he goes, well, we have a few molecules in the pipeline. It's like, a molecule, huh? Never going to help you with Alzheimer's. It's a holistic approach. So this is what you're going to get from some of the top thinkers. I mean, my mentor graduated Caltech in 2 years and 4 months, youngest full professor. I wish he would do something real, but now he's retired. So what am I going to do? So anyway, what I want to show you right now is hopefully where to go. Used to be up here. But that's not it. I just want to show you, what happens when you're in the wrong space at the wrong time. And this is a dear friend of mine, Judith McClosey, out of Switzerland, MD, PhD. And what she showed in 1993 is that spirochetes can cause Alzheimer's. And she's published probably 40 papers on this, proving it, Koch's hypothesis, and all different criteria to show not just an association, which she showed here, but a causal relationship. And why do I bring this up? When you're reducing recession in your gums, you're reducing gingivitis. When you have gingivitis, I was listening to Dr. Berube talk that she did on our channel a few months ago, and I recommend anybody should go to the blog and type in oral and listen to that again, because it's quite brilliant. But almost everyone with a little gum recession has some gingivitis, and if you have gingivitis, there's a good chance you have periodontal disease comorbid with it. And many of the organisms are spirochetal in nature. So, you know, in Britain, the #1 cause of early mortality now is Alzheimer's. In Thailand, the #2 is Alzheimer's. We need to take care of our teeth. Okay, really, really important. And so that's a major cause. Let's see what else I have here. Just some highlights from what I'm writing in the book slide. So away from current slide. And I'll try to wrap this up shortly. You know, Ohio State University, I like it when a big university has a viable website that goes into conspiracy theories. So this is the end of the quote on fluoride. I know everybody wants to avoid fluoride. I'm trying to dig into what it really is and what the research is saying about fluoride. There's no question it hardens your teeth. There's no question. Okay, but is that a good thing? Fosamax hardens bones. Okay, for people that when they do the bone density scan, or even men, and you take Fosamax, and it hardens the bone, but it also makes them more brittle, and they catastrophically break much more easily. So it's hardening it the right way to go. So what the Ohio State University concludes is, in all likelihood, the only significant problem that would arise from the end of fluoridation is that the Florida phosphate industry would have to find a different way, no doubt a more expensive and less convenient one, to dispose of toxic waste, fluoride compounds. But instead, we're putting that in water. Okay, so there's a link to that. A very good treatise on fluoride if you're interested, or you want to start a campaign to get the fluoride out of water. It makes no sense. We know someone, Dr. Carter, you may not know that we know someone through Mike Weiner that was the gentleman that proposed that they put statin drugs in water. You know, so there you go. And what I love about the conclusions made about fluoridation is the optimal dose is 1 part per million. Isn't that an unusual number? I wonder how they got there. Doesn't sound very scientific to me, and indeed it's not. So here's Dr. McCloskey. We talked about that. So, you know, like, simple questions. Are our teeth made of fluoride? Are our teeth created to be strong and last a lifetime? Yeah. Before processed food and like the USDA funds junk food rather than healthy food, things like that. Then shouldn't we support our bodies with the nutrients to rebuild our teeth with what they are composed? Okay, so here's a nice little link to a dentist. So why are we not augmenting the water in toothpaste with these? Calcium, phosphorus, potassium, and magnesium. Now, calcium can be a problem, but really what we have going on in calcium is a boron deficiency, magnesium deficiency, vitamin D deficiencies, things like that. So we probably we get a lot of calcium. Critical to the life cycle of every plant and animal. So it's ubiquitous. If you're eating well, you're taking in plenty of calcium. Now we'll just go over, you know, Dr. Berube in her talk says there's a wide variety in the quality of biological dentists. But, you know, the traditional dentists, most of them will not really reach the level of below the gum care that a biological dentist will achieve. So, you know, this is what biological dentistry deals with: identify infections of the teeth, but not just in the teeth. Bone is particularly troublesome. If that root canal is allowed to linger and it infects the bone, you can remove the tooth, but you can't remove the bone. So you're still going to have ongoing potential spirochetal infection. That's why removing root canals sooner than later is probably the best course of action, because it's not just, the infection is not just sitting there in the tooth and you pull it out and 99% of it came with you. understanding heavy metal toxicity, appreciating what's going on below the gum line, and using techniques better than a two-dimensional X-ray. You really should get an oral DNA or other test and a three-dimensional X-ray. Anybody over 50, anybody that has any particularly memory brain complaints. Organ meridians to identify teeth organ connections. They're pretty clear. I don't know them, but Tom has discussed them with me and how he uses them to interview his oral patients for systemic conditions. Helping people overcome sleep apnea and sinus issues by dealing with oral pathogens. Why do we suddenly in society have a CPAP device deficiency? It's really coming from the mouth. So many cases, not always, but I have a testimonial from this lady that had slightly elevated white blood cell counts, no root canals, and found out she had infection under her crown. It was pushing into her sinuses. Choosing the best biocompatible materials, using the oral inflammatory connection, doing proper testing, looking at white blood cell counts and C-reactive protein, understanding the role of proper nutrition. And proper nutrition doesn't mean just taking some fluoride thing. I know when I was naive, and I turned it down anyway, that they gave me something, my gums were receding, and had a cavity or two, and they gave me concentrated fluoride. I'm saying, how does that help with receding gum? But the American Chemical Society says it may actually help with some of the bacteria in the mouth. So maybe it does, but not the best choice. This is really important. A lot of children today have issues with chewing, with headaches, things of that nature. And, the Weston A. Price study on jaw structure, very critical. And there are great testimonials from their Weston A. Price Foundation as to when we fix the structure of the jaw, that some health problems can resolve as well. It's not just about pulling an infected tooth. Understanding pH, the osteoporosis, periodontal connection, bone eater. Bone eater. So osteoporosis, you're losing bone density. Oops. Let me get on with, compare this to what a regular dentist does: routine cleaning, two-dimensional X-ray, recommend root canals, remove mercury off without appropriate safeguards, give samples of fluoride-containing toothpaste and promote fluoride. Yeah, what I found is when recession of cavities are noted, they might recommend more dental visits, but they gave me a higher fluoride-containing toothpaste. Give little advice on gingivitis and periodontal disease at its earliest stages because they just comply with the ADA. Preventing cavities is a potentially lost customer. Here's Dr. Tom's protocol for home oral care that he calls how to clean your teeth naturally. Oil pulling. You can use sesame oil or coconut oil. Coconut oil contains lauric acid. The coconut oil itself being non-polar, can penetrate biofilms. Lauric acid is somewhat of an antibiotic. To maintain good pH, rinse with water. You may not be able to brush, but drink and rinse with water to let your physiology set the pH rather than, if I have a buffered pH of 7.4 in my blood, and then I'm taking in a lot of acidic drinks, it's going to take a while for that pH to go back up to slightly alkaline in the mouth. And you want alkalinity to prevent bacterial growth. Drink a full glass of pure water with a small amount of sea salt daily and fresh squeezed lemon juice. Robert's doing that with his Baja Gold. Add back the minerals. And just continually drinking mineralized water. So I have a salt that I make up with sodium, potassium, magnesium, and then I take this one daily, but there are others. I think we've talked about that before. A fulvic humic mineral mixture get the trace nutrients. Very important to do that. I take a capful a day, nothing major. More, Tom likes the Sonicare, the ultrasound one rather than the rotary one. You can make up baking soda, coconut oil, and peppermint paste yourself. Chew gum, or if you chew gum and must eat sugar, then xylitol. What I learned from Karen Kishnan of Microbiome Labs is that if you're chewing gum, you're sending a response for hunger. So, you know, chewing gum may be a good way to, you know, entertain yourself and prevent from eating, but it actually does just the opposite potentially. Consume sufficient anti-inflammatory foods, cod liver oil and fish oil. Now we know we have to eat fish 3 times a day, 3 times a week, and take some supplementation in fish oils to get our EPA blood level up to 8% or more. Taking boron and silicon compounds that support the parathyroid hormone, thus calcium balance. Your teeth are mostly calcium phosphate. So Mercola has a very good blended boron product called Bone Restore or Bone something, which contains small amounts of boron, probably adequate. Oops. And then Tom says, I have a crazy friend who wrote a book that brushes with Pure Lye soap. As hard as that seems, the soap helps remove biofilms, and it's also alkaline like baking soda, so it's a very inexpensive alternative to toothpastes. If you make a toothpaste at home, add a touch of essential oil, especially clove and thieves oil. Of course, never use traditional toothpaste, especially those with fluoride. That crazy friend, of course, is me. Floss with water and string tape daily. Avoid using aggressive antipathogenic additives like peroxide. If you have a bad case of gingivitis, use peroxide. Rarely may help, but it also destroys the oral biofilm necessary for healing. So add iodine or salt into the water flosser tank. And this is the lady that said, you know, underlying infection of some kind revealed by white blood cell counts. And then she did the MyPeripath and found out that she had modest to high levels of oral pathogens. And then she got the scan and they found the infection under tooth 15. Crazy considering I've had 0 pain in that tooth of sinus. That's why, you know, the oral test is a way to tell that there's something going on and take some action. Let's not wait in this area. This is true preventative dentistry. And let's see. Do you have a CPAP? This is my sarcasm written in the book. Do you have a CPAP deficiency, machine deficiency? So, you know, could it be that somewhere along our evolutionary development, we lost the attachment of this machine to our head? Okay, a little sarcastic, but my brother, he gets free medical care being a military vet, you know, so whatever his VA doc tells him, so he happily wears his CPAP. And now you better clean that thing because you'll get bacteria in that and it's nasty. But according to Orthodontics of Texas, people with obstructive sleep apnea are more likely to struggle with moderate to severe periodontitis, chicken and the egg syndrome here. But they're even more likely to develop whatever this stuff is, TMD disorders. And that is not from the CPAP machine or the sleep apnea. That's from destruction of the bone. In my opinion, this statement is the cart before the horse. That is, they have the periodontal disease for a long period of time, and the 2D X-ray is not adequate to articulate where they are on that bone loss continuum. So Dr. Tom is writing his book. It's not published yet, Matters of the Mouth. He explains obstructive sleep apnea. One of the most important topics of dentistry today is oral fascial myology. So this is something, if you have children with jaws way out of whack, grandchildren, probably want to get that investigated because it can have long-term health consequences. I know my middle daughter, you know, her mouth was very much disformed, braces, very narrow. And she has a lot of health issues that we're slowly working through. I'm not a doctor, so it's like she's kind of traditional, likes to work with a doctor. But anyway, and this is Dr. Berube. I really recommend you go on our blog and rewatch that video, whether you have an oral issue or not. It's a great insurance policy. So you just go to healthyvitalpartners.com and click on the blog and just put in oral in the search, or you can just use this link. I see many patients that have had heart attacks and the physicians didn't know why it occurred. The oral DNA test can be very illuminating. This is but one tool that can be used for diagnosis. Other simple methods that can be employed by any clinician are obtaining a HSCRP, white blood cell count with HSCRP, evaluating hemoglobin A1C, reasonable. I mean, sugar promotes having ample sugar. The bacteria love that, and of course, vitamin D. So let's see where we are. And with that, that's all we have for today. But I think what Robert did is extraordinary. Tom Lockensgard, one of the most well-known and certainly the most loved biological dentist, such a sweetheart of a human being. I showed him these results, and his response was, it's just not occurring, in the general population whatsoever. And, I think Robert's conclusion is right, that the Dioxy rinse had a major push at pushing him over the top and getting the tissue will rebuild. If you have blood flow, there's a good chance that you can restore whatever's been lost. We see that in Alzheimer's and any disease that reverses. Blood flow and tissue repair is part of it, and your gums are part of this whole process. So there's no question that that the result, anecdotal as Robert admits it is, as a one-off, is something that can be done. Now, I have a consult with a gentleman who water flosses 6 times a day, and his first oral DNA pegged zeros on all 11 pathogens, zeros, no indication, and no one else has even come close to that. There have been some good results. And then he said, well, what if I stop doing 6 a day? And I don't know exactly how he changed his oral protocol, but then we ran it. I said, you don't have to run it again, but he wanted to run it. And there was just a little blips of some of the organisms. I can't remember exactly what they were, but, so if you clean well, even if there's something down below, you're kind of like vacuuming some of that junk out. And, you're certainly not challenging your gut with those organisms. Because if we're detecting it in the saliva and you're swallowing 1.5 liters of saliva a day, guess where those pathogens are going? And so they can potentially get into your bloodstream if you don't have adequate stomach acid to snuff them out. So even though it's a saliva test, we're not grabbing a sample from below the gum line. There's a very good correlation between periodontal disease concentration down there and what we see in the saliva above, but it's more to it than just the saliva. So we have so sadly the ingredients include things like saccharin. Yeah, you can make your own. I mean, I'm not going to tell you how, but you can get pure sodium chlorite, and you can get the acids that they use to activate it. And I'm sure somewhere out there is a formula to make the equivalent. But see, you're not swallowing the stuff. So maybe everything has a risk-benefit analysis, right? Certain things with no risk that don't have a benefit aren't doing anything for you anyway. So, but it's all natural, whatever. So you got to look at the risk-benefit analysis. And if your oral DNA test is bad, or you had root canals or things like that, then doing this once in a while may not be a bad thing. We have a thumbs up. We have a thumbs up, or is that a question? And if you have a question and you want to come off of the mute, help yourself, because I don't think I'm preventing anybody.
I have a request. If you could put Dr. Tom's protocol back up. I was writing down some of the steps while you're answering other questions.
We can do that.
That'd be awesome. Thank you. And I'll remute myself. Thanks.
You're welcome.
I have a question. Do you, did that man have abscesses?
No, I don't believe they were that to that extent. Just recession.
Okay. And then how do you deal with the, so when you find the spirochetes, is there a treatment for the spirochetes?
There is. Now, I won't go into that, but we're going to have a couple people on in the next month or two that will talk about it. You know, my approach is antibiotic. Dr. Carter's approach is more natural. You know, I would have to refer you to a MD to go down that path, and Dr. Carter may or may not do that. It all depends on budgetary concerns and where you are on the spectrum of pharmaceuticals versus natural things. But, you know, Lyme disease, you know, these are in the chronic phase, and they can go into different forms and hide. So no matter what you do, it's not going to be a short-term treatment. But the most important thing you can do is turn the spigot off, and that's the mouth.
Mm-hmm.
You might have got a tick bite 40 years ago, like I did, and then something cropped up later under a situation of vulnerability, but the source was long gone. And so you can potentially manage that. But if you have an ongoing source, it can only go in one direction, get worse.
Okay.
So that's a consideration there. But there are a number of things you can look up, you know, treatments for spirochetes. They're not uncommon. Lyme protocols, Jay Davidson and folks like that developed the cell core program for that and other things, which Dr. Carter implements. So lots of choices. I don't like going into treatment on these because we like to know where your portfolio is.
Okay.
Pam, I'll move to the other page on Tom's protocol. So there we go.
Thank you.
Let's see. I wish you did BIH or have someone on your program talk about that. Don't know what that is, but I can make up an acronym for it. I would love if your service offered nutritional baseline testing as a precursor to the, you know, Dr. Carter's can do that, but see, I'm not dissuading you from going there, but in my humble opinion, nutritional deficiencies can be solved with some of the things we put into our report that everybody gets, nutrient density, but then fixing gut. You know, it's very clear homocysteine can go up, lack of B vitamins, but lack of absorption of B vitamins, things like that. So in my humble opinion, if you want to get nutritional testing, it's going to add some cost, which I'm trying to avoid initially, but go the Dr. Carter way. I'm all in on that because his depth and breadth of knowledge is superior to most people, even in the functional world. Okay. However, let's fix gut first and then do the nutritional testing, because if you're nutrient deficient, guess what we're going to do? Work on the gut, not give you extra supplements for those specific minerals right out of the chute kind of thing. So that's philosophically why we don't do that first. I'm trying to keep it as, you know, we're not going to catch everything, but catch as much as we can at lower cost as we possibly can out of the chute.
Dr. Lewis, BIH is bioidentical hormone therapy.
Dr. Carter is an expert on that.
I was told by Jody that he doesn't do that.
Michael, do you do consults on hormones, right? Michael? So someone asked about a family member to go with our service, which option is best for RA? So you can just do our basic testing right now on our main website. either the COVID panel. The COVID panel is just a more robust set of biomarkers, or the chronic disease temperature, either one. But there's an example of a gentleman who we really changed. And what he said is, before I couldn't even bend my fingers, now I can make a fist. Now I'm able to play with my grandkids and I'm not in pain anymore. Okay, so there's an example of what you can do. It took about 6 months, as you can see, 5 months for this to occur. So I think we have a pretty good fix on RA. But the first thing I'm going to do with anybody with RA is get them, understand their mouth and get an oral DNA test, because high correlation to that. So let's see. I'm just trying to see if I can find Dr. Carter, but so let's see what else we have for chats. Only 47. Looks like it's an interesting topic. Sadly, in the ingredients, yeah, we talked about that. Wow. Yeah. Martha pointed out all the ingredients. But I think you can make it. But then again, look at the results. So it's like, there's no free lunch. I mean, can you avoid drinking in glyphosate or being exposed to it when you're outside? So we're all going to be exposed to some things that aren't necessarily the things we want to be exposed to, but the dose makes the poison. Anyway, how much of the povidone iodine do you add to the water pick? So it's been trial and error for me, but I add enough that the solution is dark brown. I'm not even measuring it. The other thing is, though, if you spray the water flosser and it's foamy, you've added too much, because we want a good strong jet. So, you know, what is the antiseptic level? Any iodine is going to have some level of antiseptic properties. So I want to maximize that, but also make sure you have a strong jet. So you just play with it. I basically just take a couple squirts of my povidone iodine bottle, and I'm putting in, you know, maybe 4 milliliters, something like that.
Question. What are you doing, though, to the production of nitrous oxide and things like that?
Not sure I know the answer to that question.
Because, you know, you talk about peroxide and mouthwash, you know, those are all highly not recommended.
We stay away from mouthwashes that are antibacterial.
Yeah.
You know, coconut oil, you know, look at that as a food. Doing some of this oxy rinse once in a while, especially if you test positive, you have recession. I think that would be a worthwhile thing to do, but you can certainly try all these other things. But I think peroxide is the most deleterious because of its very strong, broad spectrum anti-organism effects.
Yeah, and that's one of the problems with whitening toothpaste. You know, it destroys the nitrous oxide production, which is now apparently determined to be very, very important to overall health. And I'm wondering about iodine and things like that, but certainly coconut oil, salt, things like that would probably not impact that.
Well, you know, iodine's a natural substance too. I mean, we have to get iodine and I can guarantee you, if you take it in as iodide, your body will convert some to iodine. It's not just things aren't static in your body. So I think it's a fairly natural substance in the milligram range in your body. Well, low single digit milligram, but still there. So, you know, it's always a battle. I mean, if you have you know, if you have a severe infection and you're going septic, you're going to get antibiotics. It's a risk.
Yeah.
There's a risk benefit along the continuum, no matter what you're talking about. You know, too much water. A friend of mine won the national championships in cycling, and he went into a electrolyte deficiency and nearly died by drinking too much water. So it's like there's no free lunch anywhere.
Thank you.
So we have Joyce says biotech has an oral switch based on hypochlorous acid. Would love to understand how this compares with the Dioxy rinse. See, you can certainly try that, Joy, but see, Robert's meticulous at recording things, so it's not anecdotal, at least in his case, and I think it could be non-anecdotal for other people. But I think the hypochlorous acid is on the spectrum of what you're getting from the Dioxy rinse. I think you're getting chlorous acid, which is a slightly more muscular cousin of the hypochlorous acid. So, yeah, I mean, Judy brings up the point of swallowing it. I mean, you might absorb a little teeny bit, but we got to have faith in our body to be able to detoxify from some of these things. When water flossing 3 times a day, is it with water only? He mentions how often he does the povidone once a week, maybe puts some salt in there occasionally, but if you're, my gentleman that did 6 days a week was just 6 times a day was just using water. So how do you deal with spirochetes? I think we answered that. Yeah, and you're right. I mean, there is sublingual absorption, and I think hypochlorous acid is certainly a way to go once a week with a povidone. Fluoride is more common than we think in pharmaceuticals, because sometimes they'll use fluoride to make a new molecule that otherwise had a hydrogen there, so they can patent it. So you'd be surprised where fluoride should show up. What about biocidin? He didn't use that. I think essential oils would be brilliant. I'm just presenting something that is, Dr. Stark, that actually has results to talk about. So that's why I'm on this bandwagon. Yes, I understand, Judy, with the CPAP. I have a theory on that, but I'm not going to tell you because I don't want you to stop using it because of me. And with that, we're at the top of the hour. And as usual, I think I saw Dr. Harshfield on that is going to land the plane. Are you out there, Dave?
I am. I think this is a great topic. I think we've sort of brushed on this topic before. We talked about voltage is healing with Dr. Tennett's work and how important the teeth are. As an embryo, every one of our teeth are in a circuit. And for instance, your wisdom teeth, if you have trouble with your wisdom teeth, the circuit that disrupts, it's like a circuit breaker when you have a problem. Each of your 32 teeth have got a specific function. And when you have an abnormality of that tooth, then you can back into a systemic problem they may have. The spleen, pancreas, stomach circuit and adrenal gland is affected by our wisdom teeth. I'll just take that for an example. That's everyone's familiar. Starting in the 60s, we started noticing a craniofacial disproportion. The faces of humans started getting smaller, and teleologically, this should take millions of years. This started happening. We've started looking at what is going on here, and what they trace it to is little kids having these infections, ear infections, throat infections, so forth, and it stunted the maturation development of the face. It also was complicated by the fact that we didn't breastfeed as much. And with breastfeeding, it develops the hard and soft palate in the jawbone. So then we started seeing people with TMJ, temporomandibular joint issues. And we treat those all the time now. It'd be nicer to see it in the kid, but often we'll see older adults that have big muscular masseter muscles. And we can use Botox to weaken those muscles so they don't grind their teeth at night. These are all sort of stopgap procedures we have to do after the fact. a lot of the dental issues start, I think Steinemann several decades ago discovered that substances move through the body through the pulp chamber. And if you look at a tooth, it's got thousands of miles of small little tubules in the teeth. In the odontoblasts, which are your stem cells in your teeth, are pumping fluid. So your interstitial fluid, and that's what Dr. Lewis is teaching us, by what we eat and so forth, what we're doing is maximizing the potency of our interstitial fluid, which can then be pumped into the cell intracellularly or through tissues. And if it's healthy, the tooth, for instance, when the odontoblasts are working when you're a little kid, it's pushing fluid out of the teeth all the time. And some little thing will happen. Even emotions, that's another discussion Amy Marshall talked about. But certainly infections in the teeth or antibiotics, suddenly those odontoblasts stop pushing fluid out. Well, guess what? Bacteria start to come in. And that's sort of where it starts. And he proved this.
You're doing brilliant. And just to interrupt, but
Oh, sure.
Guard said the reason why fixing, particularly in kids, their bite, if you will, because if your bite is off, there can be a lot of pressure applied to specific teeth. And now, you know, you have a root canal next to that thing, and you're literally, it's a pump. You're pumping the fluid below the gum line at the root into the CNS, central nervous system fluid, and the bloodstream. So bite is very important. So you're not pumping the toxins into your bloodstream.
I think that our true biologic dentist, they're looking at, when they look at you, they go, okay, here we go. Got to get rid of these root canals, all these issues right now. But what they're going to do today is going to be predicated on what we're going to do down the road. They all draw a roadmap, to Dr. Lewis's point. Your dentition, you got a bunch of opposing teeth, and they need to play together. And these aren't correctly positioned, so we're going to develop your bite. It's going to take a year or two, again, log linear, so that you don't have these abnormal forces when you're biting. And we're going to stop the grinding of the teeth at night. So really good biologic dentists, Thomas, to your point, they're looking down the road. They go, okay, here we are today. We got to fix this stuff. You need a dentist that's thinking long term, not just playing whack-a-mole. Anyway, that's probably more than you want to hear. But I just think it's important to kind of think about why teeth stop pushing fluid outward. And it's generally because, like in kids, they may have an oral infection. Here's another thing that happens. Emotions are tied to your teeth. And these kids that are having emotional disturbances when they're young, that affects the electricity in some of these teeth. And you add that to maybe a chipped tooth or they get trauma or something like that. Suddenly now we're starting to understand how important those 32 bones that the medical profession gave away, because I guess we didn't want to deal with them. But we got to grasp that. We got to get them back into the corral, start taking care of these teeth. They're very important.
Right. And, you know, absorption from the gut, microbiome plays a major role in getting raw materials there. You know, why do pregnant women crave a pickle? Get some more acid in your gut. Now these athletes, particularly these long endurance athletes, are chugging a little pickle juice along the route because they're emptying out their stomach and they want to get some acidity back so they can absorb the nutrients to keep them going. So micronutrients are at the core of almost everything. And there was a really great point in the question raised about why aren't we testing for micronutrients? Because I think the solution is improve gut and improve nutrient density, and then you'll probably be okay. And there'll be cases that won't be completely true, but I bet you one of those two are still slightly off. So that's kind of our philosophy on that. So rebuilding, you can rebuild teeth. I mean, Josh Axe has published on this. You know, he talked about it anecdotally, but others have, you know, it's just tissue. And you create a pressure and raw materials to rebuild enamel with the right things, it will rebuild. If you can insert fluoride into your teeth, you can insert indigenous, you know, more common nutrients into your enamel as well. with that, I know there are tons of questions. It looks like this is an important topic, and we will endeavor to take it up further. But I will publish this. I think there are other. I think the chlorous acid is a good alternative to the, the Dioxy rinse that you can make on your own. And Dr. Harshfield's an expert on that. And we did publish on our blog how to make his formula for making hypochlorous acid. So I think that would be a good alternative. If anybody wants to measure their recession and help us understand before and after whether it worked or didn't, I think that'd be very helpful. So oral's that important. Thank you all for attending.
Thank you, Thomas.
Thanks, Tom.
Thank you, Dr. Lewis.
You're welcome.
Thank you, Dr. Lewis. Great presentation.
Thank you, Dr. Lewis.
Bye now.